Hi, my name is Kim. I'm here to inform my family and friends about veterans health care. Imagine living on the street with no money, with an injury or disease caused by war. We have all heard about veterans health care before, but does anyone actually know its effects? I chose this subject because of the issues I've seen my stepdad go through while filing a medical claim. I've seen him go through constant issues in receiving disability for an illness he got while serving our country. He filed for disability and they denied his claim for negligent conduct. They told him he did not have enough support and evidence to file his claim. He appealed his claim and they denied it again. He has stacks of papers that have accumulated over the years in dealing with this issue. I'm going to be covering the cost of health care for veterans, our veterans homeless rate, and how to file a medical claim. This subject interests me in hoping that someday veterans will get the care they deserve. There seems to be an endless debate right now on Capitol Hill in Washington, D.C. on how much money should be spent on the health care of our veterans. Chris Daniels, authors Veterans Health Care Costs around $650 billion, published in King5.com staff report last year says, and I quote, "While we endlessly debate in what we are gaining in Iraq, hundreds to thousands of soldiers and their families are falling victim to death, post-war trauma, and lifelong struggles with mental and physical wounds as a legacy of this war. I believe that if our government expects our young soldiers to defend our country while getting injured or possibly dying, the government should be able to supply the funds for the health care for their families upon returning home. One study showed that the estimated health care cost for soldiers returning home after war is at $650 billion. The current VA funding is actually around $87 billion. The same study also stated that some soldiers that return home after serving our country are at risk of becoming homeless. Veterans currently make up 25% of our homeless population. This makes you wonder if the money veterans are spending on health care is so great they are unable to afford adequate housing. A majority of uninsured veterans have served in the Vietnam War and other recent wars. Veterans who served in the Korean War and World War II are over the age of 65, thus making them eligible for Medicare. The number of uninsured veterans is currently near the 1.7 million mark. Of these uninsured veterans with serious health problems, 20–30% reported that they were delaying or could not afford medical care, eyeglasses, or prescription medications. Over 40% of these veterans said they had not had any medical treatment over the past year, and 2/3 say they have not received any